Hi, I'm Heidi Basfield, Executive Director of Speak Our Minds and Speak Our Minds podcast. Suicide remains the leading cause of death for our nation's youth. It's nothing short of a continued public health crisis. And on this series, we wanted to team up with providers and talk about what children's hospitals and their teams throughout this country are doing to take on this challenge and work every single day to have things be different, better for our youth. As part of this series, you'll hear from those providers, their teams, and what they're up to. They'll talk about new practices that they're putting into place, what they think has changed about the conversation with youth mental health, what their biggest obstacles are, what they would do about those obstacles, and what they're really excited to be a part of over the next 5 years. We also feature stories from parent caregivers who really bring home why this work is so incredibly important and how we can all join and be part of these efforts as a collective to turn the tide and prevent youth suicide. Thank you for joining us for Preventing Youth Suicide, a series focused on bringing about change. Okay, I'm here with Dr. Justine Larson, who is the Vice Chair of Psychiatry for Children's National in Washington, D.C. And the question that I posed to Dr. Larson was, are there programs or community models that you think could truly change the game for youth mental health?
I think about having a vision for being able to provide mental health care for kids where kids are.
What does that look like?
So for me, I think about where should kids be?
Yeah.
Kids should be in schools.
Yes.
Kids should be, sometimes at their primary care doctors.
Right.
So that's why I think kind of stemming from that, I think we actually already have some great models out there that work. And I think kind of the concept of keeping kids where kids belong and bringing the mental health care services to them.
Yeah, it's like a foundational premise.
Exactly.
Okay, walk me through one of your favorite models that does what you're talking about.
Well, I think school-based mental health. I'm a big believer in school-based mental health because people often, not always, but have a positive association with school. It's a less stigmatizing place. And I think that kids can sort of receive the services there while they're in school and just making that part of their school day. So I think there are a lot of models out there for behavioral health care in schools, like, models like different ways of paying for it, for example.
Sure.
But I think that there's a great deal of promise there.
Do you like the idea, like if you got to pick, right, if you're in charge of the world for however long you needed to be to make this happen, do you like a scenario where it's like you have personnel within the school that is providing these services? Is it a school-based mental health clinic that's attached? Like in your mind, when you've looked at this and worked with these, what do you feel like if you got to choose, like if everybody got to have this approach, what would you see as being better?
Yeah, well, so I think that there are different programs for different people. Like I'm a believer that you can have a lot of possible models and there can be different doors for kids to get in. So school-based models, you can have, for example, school-based health center, which is a model, and you can have mental health services that are attached to the school-based health centers.
Right.
You can also have school-based services where like a different agency, for example, a federally qualified health center can have a relationship with the school and can put services into the school.
Yes.
You can have services where the state or the county sponsors providers to be in the school systems. So I think that all of these things can be great because I don't think there's like a one size fits all.
Right.
And then even in primary care integration, there are a lot of different models.
Right.
There's sort of collaborative care, there's integrated care, and they're all good and helpful because people want to come in with through different doors and they should be able to. So I think kind of supporting all these different models for different people is really, really good.
Do you think the age span, so I'll ask the question this way. We have elementary schools, we have middle schools, we have high schools. If you were to say tomorrow, we need to focus on one of these three as like all in as our starting point, is there an age group that you feel like is foundational in a school-based strategy?
That's hard. I mean, I think on the one hand, I think it's really, maybe the idea could be sort of when you look at that sort of the triangular shape thing, the multi-tiered system of support, and how you have kind of like the prevention services at the bottom, and then in the middle, you have the kind of secondary prevention type services, and then at the top, you have the sort of targeted.
Yes.
I mean, maybe one thought could be if you had to pick, to kind of focus on the prevention aspects, kind of in the young age, the elementary school ages, and then kind of as the triangle narrows, kind of, and you could provide more services, more specialized services in the high school years. And that's just one thought.
Right. No, that's great. Okay, so this is super fun to talk about this with you. So now we're going to move to the question we're asking everyone, which is, looking ahead, what do you most want to be part of over the next 5 years when it comes to addressing youth mental health?
Well, I feel like we have to shift our vision and our attitude and realize that we can do this. I mean, I think I feel sometimes like people have this fatalistic idea about children's mental health that, it's just getting worse and worse, and it's because our society is falling apart or something like that. But no, we're capable, we're smart, we have resources, we've got money, this country has money. We can do this. I think to kind of have this idea of this acceptability that we sort of tolerate a really bad situation with our kids, where kids are, committing suicide or dying by suicide, dying by overdose deaths.
Yeah.
It's not acceptable, and we completely can do this. Yeah. So to have this idea, but to all rally around it, though, not just the mental health providers, but the primary care providers, all of the people that work with kids, educators. But I think we're very capable of really making big changes.
And you're going to be part of that.
Yeah.
That's incredible. Well, Dr. Larson, you all heard it here. The answers to innovation, so to speak, and effective models, we got to start with our schools, and then making sure that we're all coming together and being positive about, we can do this. We can solve this youth mental health crisis. We can make positive change. Thank you, Dr. Justine.
Thank you.